Hey guys, it's HINA here at Rebalance Physical Therapy and Wellness in Center City, Philadelphia, as well as in Narberth, Pennsylvania on the main line. And I am an orthopedic and pelvic floor physical therapist that treats with a holistic and functional medicine background to treat a lot of spine, hip, and pelvic floor disorders. And I want to talk to all those here today that might be having symptoms in that saddle sitting area, or what's called the perineum, and you feel like your pain is kind of moving around. And so I had a client yesterday that I was talking to on the phone, and she was telling me how, she was leading a very normal life, and then all of a sudden she started experiencing chronic urinary tract infections, which she ended up clearing up. However, she ended up having a lot of bladder irritation, vaginal pain, and then it also moved in and around the rectum. And then she has said she actually ended up having some treatment, which ended up helping the front part in terms of the bladder and all that kind of stuff, but that she still is having this pain that kind of moves around. And she can't pinpoint where it is, but she knows it's in between her hip and her vaginal area. Now, I don't want this particular video just to talk about females, because this can happen in men as well. And for men, instead of a UTI, it could be something else. It may start as like a prostatitis, or maybe even for you guys, maybe a UTI, but it ends up causing a similar type of pain where you have pain in the urethra, pain in the rectum, and then it kind of moves around. So this pain in this area that moves around feels like it's in the front part of the perineal area, and then it moves to the back. Sometimes it feels like it's in the bladder, sometimes it's in the rectum, and it feels like it's this maybe tingling, maybe sharp pain, maybe it's just this deep throbbing that moves from one place to the other. And you guys have gone, to your primary care physicians, you've gone to your colorectal doctors and they can't really find anything. You've gone, to your urologist, they've done all the testing, there's nothing there. Perhaps you've gone to your gynecologist and nothing is there either. So what's left is that many, and I would say many, just to add on, is that if all of that has been ruled out, it's likely that there's a musculoskeletal issue that's going on that involves the pelvic floor musculature. And I know it seems hard to believe that how can a muscle actually cause this issue? But believe me, I've been doing this 20 years. I have a whole practice that is geared towards just focusing on a lot of patients, where 90% of our clients are pelvic floor clients, and we deal with this all day with 4 practitioners treating this. So we've kind of seen it all. We treat a lot of complex patients, and this is often what we see is sometimes this pain that moves around, and it goes from front to back, back to front, and no one really knows what it is. And so this is where the role of what we do is so important. It's kind of to help figure this out, find out what's causing this pain, and then help treat it. So in a nutshell, you basically have a group of muscles called your pelvic floor muscles inside the pelvis that you can't see. And this is why it's difficult to diagnose for someone that isn't truly familiar with and treats this a lot. So this is the pelvis, okay? So this is your pelvis, and if you're looking from the head down into the pelvis, you see a lot of this red stuff is actually the pelvic floor musculature. And in here, just like all other muscles in your body, you basically have nerves that run in through here. So if you imagine, if we compare this to like a pot of soil, and you have a plant in it that has roots. The roots are basically the nerves, and the soil is basically the muscles right over here. So you have nerves that can run all in and around these muscles. And if these muscles become spasmed or they become too tight, then they can press on those nerves, and they can cause all sorts of pain that can vary from shooting sharp to throbbing to achy. And it can cause you all sorts of issues, from having difficulty after, or pain after a bowel movement, to pain with intercourse, to, pain with sitting. These are just to name a very small amount and a very few. But, the symptoms and the functional issues can run rampant. And so those are just to name a few. So basically, if this is going on and you feel like no one hears you, no one understands what's going on, realize that there are people out there that actually understand what is going on here. And you might need a specialty pelvic floor physical therapist that really understands how to treat not only pelvic floor, but understands how to treat pelvic pain, because there's more to it than just going in and start treating here. Sometimes, there could be specialty physicians that get involved that might need to be involved in your care. And this is where, we may evaluate you as a pelvic floor physical therapist and look at all these things and how everything is interconnected with not only just your pelvis and the pelvic floor muscles, but how your hip and your spine and everything else kind of gather together to figure out why this is happening. And then we actually need to treat this musculature by going in, calming these muscles down, and treating all the other muscles that kind of interconnect and interplay with this area. But sometimes, especially if the nerves are involved, then sometimes there could be certain medications that need to get involved, or certain plans of care that sometimes do involve maybe a specialty physician that understands the pelvic floor musculature too, which at least in our practice, we work with a lot of other specialty physicians sometimes to help get our patients really on the right track. So basically, if you are suffering from this, and this is not a video to show you what you can do at home, because, there's a lot of different things that encompass truly evaluating what's going on and then really getting you into the right direction. So for those of you who are looking for a treatment that you can do at home, it's not as easy as showing you a YouTube video for this. So please do not leave me comments that say, well, show me the treatment. This is really here to help those who are suffering from these types of symptoms so that they understand what might be going on, and for them to realize that there is help out there and that there is people such as pelvic floor physical therapists that specialize in pelvic pain that know how to treat this, so that you guys have some guidance as far as who you should see next. Now, if this video resonates with you, then we have lots of other YouTube videos that you can jump on to help you kind of dissect and even learn more about what the pelvic floor does. And we also, if you come onto our website, rebalancept.com, that's REBALANCEPT.com. You can sign up for our newsletter, sign up for our blogs. We have lots of other helpful reports and things like that you can sign up for. However, if you live in and around the Philadelphia area and you want to be a client with us, then you could you could qualify for a free consult with us, so we can talk to you, figure out exactly what your symptoms are, and then make sure we team you up with the right physical therapist to treat this with us. So I hope this video was helpful for those of you who are, feeling like I have no answers, I have no idea what's going on. This is very, very likely that this is what's going on and that there is help out there. And so I hope this was helpful for those of you who are having these symptoms. So take care and have a wonderful day.